There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question: how does high blood pressure damage the brain? High blood pressure damages the inner, in health smooth, lining of your arteries, making it easy for cholesterol to collect, narrowing and at the end closing off the artery, in the brain causing an ischemic stroke, in the heart a myocardial infarction. C. High blood pressure dangers, hypertension's effects on the body. As you can see, having hypertension, treatable, along with smoking, avoidable, is also a very important factor. So is hypercholesterolemia, treatable, are the most important factors correlated with having a stroke. We call high blood pressure, hypertension, the silent killer. Since it causes no symptoms, only less than 80% of the hypertensive aware they have hypertension. Of these, less than 90% are treated. Of these, only 2/3 are controlled, usually due to sloppiness of either the doc or the patient, bad compliance, see anonymous answer, or both. So at the end, greater than 47% is controlled. It is an important oft-occurring disease. It costs a lot. Controlling high blood pressure pays off. It can cause transient ischemic attacks and stroke, myocardial infarction, heart failure, renal failure, blindness. So is much more risk than just stroke. In my last year on the job, we admitted a 40-plus-year man with extreme high blood pressure we call a hypertensive crisis, causing his brain to dysfunction, like being disoriented, confused, having slurred speech, nauseous, having severe headaches. Later on, we learned that 15 years prior to this episode he had been diagnosed with severe hypertension, but having no complaints, didn't take his meds, nor had somebody monitor his blood pressure or kidney function. When the blood pressure had been attended to on our intensive care unit, without him having a stroke, we found him to be in end-stage kidney failure, so he was directly transferred out to our dialysis department. And knowing time on the waiting list for a kidney transplant is around 7 years, and all this could have been averted had he not been so obstinate and foolish. So having your blood pressure measured properly once every year is useful, not the rest of the in America so popular medical checkup. See general health checks in adults for reducing morbidity and mortality from disease, Cochrane Systematic Review and Meta-Analysis. General health checks did not reduce morbidity or mortality, neither overall nor for cardiovascular or cancer causes. I hope that helps. If you need more answers and advice on hypertension, I've included some links in the description.